these groups for the last year, and they will give us an update on their work. The working groups meet at least once a quarter, and the chairs have prepared a brief update on their progress and way forward. And the call for you is to please join these working groups. And you are invited to do so by looking at the website to sign up or at the footer of the booklet. So the person that's been leading the training education, I'd like you to come up, Dr. Michelle Durham. Thank you very much.
Okay, so over the past year, I had the distinct honor of being the chair for the Training and Education Work Group. This was my first year as the chair. We have a robust group of folks that are working alongside me, but we still need lots more people to join our Training and Education Work Group. So I'm gonna say it one more time, what Bonga mentioned. It says agmhi.org at the end of your booklets in the footer. We would love for you to join our working group. I realize that this is taking time out of everyone's busy schedule, but we actually need more ideas and more people and more interest in thinking about how do we move this forward of thinking about education and training across the diaspora. I'm obviously in the United States, so I would really love for someone that is on the continent to join as a co-chair for the working group or a chair, either way. So we're going to start a new year pretty soon. And so whether indicating on agmhi.org, talking to me, talking to Sanait or Site, who help us really organize all of our working groups. While you're here, if you have an interest for any of our working groups, but I know for this one in particular, I am looking for either a chair or co-chair to help. And it would be great if it was someone who was working day in and day out on the continent, really thinking about education and thinking about it across the workforce. So this is not just psychiatrist driven, but psychology, any therapists, counselors, thinking a lot too around, our workforce extenders like community health workers as well. And so people really thinking about how do we do this when you don't have a lot of people in the training space, whether that's modules or whether that's webinars, and question mark for whatever else is out there that we need to do. A couple of our goals were to address the training and educational needs of people in Africa and the diaspora across various mental health disciplines, and then facilitate the sharing of knowledge and information most beneficial to people on the continent. So we've had we meet quarterly, I should say. So we meet quarterly, but we also, in one of our first meetings, decided to do webinars this year. So that's not something we had done previously. But during the COVID-19 pandemic, at the height of it when it started, Bonga and I had led a couple of webinars, but then it kind of fell off as we moved on in the pandemic. And so we decided for this that we should maybe start that back up again. And they've really been just really panelists in a conversation. So it's not slide driven. It's very much so our panelists from different walks of life, whether they're community-based clinicians or researchers, joining the webinar, speaking on particular topics. So we talked about public health through the lens of community psychology this past year, and then how to tackle mental health needs for rapidly aging Africa. Isaac is in the back. Isaac is apparently very popular because we had over 200 people at that webinar. So I think that was the most attended webinar we've had. And so Isaac, I guess he knows a lot of people. So it was really well received. And so much so that one of our panels tomorrow will be with Isaac and his group about thinking about aging in Africa. And I think it may have been just an interesting topic too, because we tend to focus a lot. I'm looking at Anusha up here on child psychiatry. I'm a child psychiatrist as well. And so it was I think we just need more heads to come together to think about what other topics would be really critical for the continent and for what we're doing. We're also going to do a joint webinar with the clinical care delivery work group, who's going to come up next and present on thinking about substance use. And so we are already reaching out to speakers and planning that one for January 2025. Sorry, these are the flyers that go out when we do our educational series. I think the challenge, I probably maybe have said that a little bit already, is that it would be great to have someone based in the continent who would want to support this work. Organizing webinars across different time zones is always challenging, and getting speakers that are on the continent, maybe the US, but anywhere along the diaspora. So that's always a challenge just in coordination. The other thing that was with the prior group prior to me is that they had started doing some trauma module that were like webinar based that they wanted to put online. So when you go to our website, we want to really build up like a resource base, if you will, with educational topics. And so we have not done a lot with this particular module. There were a few people working on it last year. With time commitments and other conflicts, it's something that I am interested, so at lunch or anytime you see me today, I'm interested to think, it's for you all to just think about, would web modules that are on particular topics just sort of sitting on our website for people to access something that you think is feasible, doable, is something that we should continue pushing forward, because obviously it takes a lot of work from anyone involved to do that type of thing. I'm going to pause here. We don't have a lot of time for questions, so I'm going to ask that you, if there's one burning question, I'll take it now, but if not, come and find me at a break or lunch. I'm happy to have further discussions and any ideas you might have to move this work forward, and any interest in joining the work group to let us know too. Thank you. So now, you want me to? I'm going to introduce the next, Dr. Latchman and Dr. Paruk. I think Saida's coming up to do this part. Is she here? I don't see her. Oh, she's back there. They have been leading the clinical care delivery work group, and they're going to come and talk a little bit about their work this past year.